I wanted to take the opportunity now to formally thank the Planning Committee who put this wonderful two-day workshop together. It included our Roundtable members, Russ Pate from the University of South Carolina, who's worked so diligently not only in planning but also, as you know, each and every day of this meeting, Cedric Bryant, Kitty Sue Dana, and Chris Economos, who is not here with us but is here in all that you see. Also, Loretta DiPietro, John J. Kiesick, Bill Cole, and James Rimmer, all members of the Planning Committee, all critical to bringing the presentations that you have seen here, as well as an awful lot of the thought leadership in America. And with that, we begin day two again with Russ Pate.
Well, thank you, Bill. And let me take just a moment to again thank the Planning Committee for tremendous work on this project, the staff that supported us. Absolutely did yeoman's work on this project, and I very much appreciate it. And again, we were able to attract a remarkable group of speakers on very short notice, and I'm indebted to them for making time to be here with us this week. I am going to take a few moments to introduce the issue that we're addressing today. Of course, yesterday the focus was on the science that links physical activity to weight status, to prevention in particular of overweight and obesity, and the influences of physical activity on health status in those who are already overweight and or obese. Today, we're shifting the paradigm, and the focus will be on physical activity as a target or an outcome in efforts to promote that behavior, to produce higher levels of physical activity, and of course, in the context of reducing the prevalence of overweight, obesity, or the negative health consequences associated with those outcomes. Today I'm going to take just a few minutes to provide some context for the sessions that will follow today. And I think we've probably learned the hard way over the last few decades as physical activity's begun to achieve a place in public health in this country, that physical activity is a complex behavior. And I do think there are times when we use that term physical activity as if it's just some very simple construct, and it isn't. I just think we've learned that it is a quite complex behavior, that it takes many forms. It's packaged in many ways. You heard a lot yesterday, if you were here, about the various combinations of frequency, intensity, and duration, and overall dose of physical activity that are of interest. It's a behavior that's performed for many different reasons, and quite honestly, I think we know that positive health outcomes are far from the only reason that people are physically active, and historically that probably played very little role. I think historically it's probably true that people were physically active really because they had to be physically active to survive or live their lives the way they wanted to, and it really was not a volitional decision that they were making to be or not be physically active. So activities performed for many reasons, in many different ways. And if we've learned anything about this behavior over the last few decades, it's clear that it's influenced by many factors, which I think suggests that, that as we try to figure out how to promote this behavior, engender higher levels of physical activity at the population level, we're very unlikely to find a single magic bullet that is going to help us solve this problem. So physical activity is a complex behavior. The research on promotion of physical activity has typically been theory-based. A lot of different theories have been applied in designing and testing interventions to increase physical activity, and I think this background has sort of evolved over the years. One theory that's been widely applied, the theory of planned behavior, that posits that intention to be physically active is a central construct. Social cognitive theory has been frequently applied. It posits that there are important interactions between the individual, the behavior, physical activity, and the environment in which the activity is performed that profoundly influences future participation in the behavior, and the construct physical activity, self-efficacy, one's confidence, or sense of competence with regard to being physically active is seen as a very important concept. The stages of change theory has been applied, and I think drew into the mix the idea that persons are not all equally ready to adopt physical activity. Some people haven't even thought about it. Some people are thinking about it but haven't really tried it very much yet. Some people are nibbling at it, trying it with limited success. And some people have mastered the behavior and it's a part of their lifestyle. And to think about kind of approaching that whole range of persons with a single intervention strategy probably doesn't make a lot of sense. But I think as the work has evolved and people have come to think very broadly about how we're going to have to go about promoting physical activity at the population level, I think it's probably true that this social ecological model has come into a lot of currency. And it essentially is based on the premise that a behavior like physical activity is influenced by a very broad constellation of factors, some of which operate within the individual. And every multivariate analysis I've ever seen is left with a lot of unaccounted for variance in the prediction of the behavior, which probably implies that there are characteristics about the individual that we're really not able to measure very well at this point that accounts for whether or not people are engaged in this behavior on a regular basis. But we certainly know that participation in physical activity is influenced by social factors, interpersonal variables, by institutional characteristics where people spend their time, by the community characteristics where they live, and by even more distal influences related to public policy and mass media. So I think as the work on promotion of physical activity has evolved, this social ecological model has, in a sense, become a framework that's guided a lot of thinking about what it's going to take for us to really move the dial on physical activity at the population level. Various intervention studies have adopted a wide range of targets in the effort to figure out ways to effectively increase physical activity. Some interventions have been aimed at individuals, some at peer groups or the family environment, some at institutions, schools, work sites, for example, where people spend their time. Some have been aimed at modifying community characteristics and resources. More recently, I think the work has moved to the policy level, and we're going to hear about that here in just a few moments, including media strategies. So interventions to increase physical activity have been reviewed on a number of occasions, and I don't have time this morning to do an exhaustive summary of this, but there certainly are some important resources out there that I would refer you to if you're interested in what some authoritative organizations have had to say about effectiveness of interventions. The Guide to Community Preventive Services does have a section on physical activity. This has gotten pretty dated. This was the current physical activity component of the community guide was produced over a decade ago. It's my understanding that work is underway to update this at the present time, but I think it's going to be a little while yet before it gets fully updated. But the community guide, of course, is a very authoritative process or product that is based on a very rigorous review of the literature, and that was undertaken over a decade ago for physical activity. A number of conclusions were drawn. Informational approaches to increasing physical activity were pointed to as having strong evidence for support for community-wide campaigns, but less support for other informational approaches. Behavioral and social approaches to promoting physical activity were studied. Strong evidence was found for strategies involving school-based physical education, social support interventions in community settings, and individually adapted health behavior change programs. Environmental and policy approaches to increasing physical activity were examined, and there was strong evidence found for creation of or enhanced access to places for physical activity. And so we look forward to the community guide being updated here before too terribly long, because there's been a lot of water under the bridge since 2002. Just a couple of years ago, at the midpoint between the release of the first federal physical activity guidelines in 2008 and 2018, when we hope that there will be a new iteration of the guidelines, a so-called Midcourse Report was released, and it focused on summarizing the evidence regarding interventions to increase physical activity in kids, and a setting-based approach to reviewing the literature was undertaken, and the settings shown here were examined. And this is a quick summary of the findings, and I'll point out that sort of the highest level of support, which was rated as sufficient, was assigned to only 2 of the intervention strategies: multi-component school-based interventions and school-based interventions that focused entirely on enhancement of physical education. And quite a number of other strategies were reviewed and rated somewhere between suggestive or emerging or insufficient. Now, in my view, that doesn't mean that those strategies are in the real world ineffective. It means that the science was available at the time when this review was done was not compelling enough to assign a higher rating. Some of these are strategies, for example, classroom-based activity breaks and so on, just haven't really been studied until fairly recently, and so the literature is still emerging. I'll also put in a plug this morning for the National Physical Activity Plan, which is a compilation of evidence-based approaches to promoting physical activity. And of course, a physical activity plan can be thought of as a comprehensive set of strategies that includes policies, practices, initiatives aimed at increasing activity in the population. The plan developed in the U.S. Was developed in a way that I think is fairly distinct from the strategies that have been used in most other countries. In most other countries that have developed national physical activity plans, it's been primarily a government undertaking. And in the U.S., the effort has been certainly government supported, and we've worked closely with colleagues at CDC and in other federal agencies, but the effort has been based outside of government and under the leadership of a coalition of organizations, for the most part national health-related organizations, but there are some that are kind of fall in other sectors. So this is the current list of logos of the organizations that are currently serving as organizational partners in this effort. The plan was developed through the effort of a very large number of people who served on expert panels that recommended that various strategies be included in the national plan. That work played out over a period of a couple of years leading up to May of 2010 when the plan was released. It was organized around 8 societal sectors listed here, and in the end included over 250 strategies and tactics. So there's a contrast here clearly between what's in the national plan and what's in, for example, the community guide, right? So I think that, there are different, strengths of evidence and rigor in the review of the literature that can be applied in identifying potentially effective approaches to promoting physical activity at the population level. The workshop plan for today is as follows. First of all, the sessions are organized around a setting format, and so we're going to be hearing from persons with great expertise in promotion of physical activity through a range of settings. What we've done is ask each of the presenters to summarize their view of the state of the art, what the literature overall says about effective promotion of physical activity through that setting, but in addition to comment on strategies within that setting that are innovative, of great current interest. And so we've asked a lot, folks, to kind of cover that whole range of issues in a short period of time, but I know they will. And we're going to finish the day with a very important session that I think will provide some examples of very creative and, importantly, sustainable initiatives that have been launched around the country, and I think it's going to be a great way to finish the session this afternoon. So with that, I am delighted to introduce Dr. Jenny Ehrlich, who will be moderating this session. Jenny is a member of the Roundtable on Obesity Solutions and is Director and Senior Program Officer of Childhood Obesity Team at the Robert Wood Johnson Foundation. Jenny?